I'm going to perform a manual muscle test for shoulder flexion. So I would have my patient seated with their shoulders slightly flexed and their hand facing prone. My stabilizing hand would be on the superior aspect of the shoulder, and my testing hand would be on the distal anterior portion of the humerus. So I would have my patient start down, and then you're going to raise your hand upwards. Nice. And I'm going to apply some resistance as she goes into shoulder flexion. Good. So I'd have her stay in this position. I'm going to push downwards, and she's going to push back at me. Great. And this would be testing the anterior deltoid muscles. I will now perform a shoulder extension manual muscle test on my patient. I'll have my patient seated with her arm slightly flexed outwards and her hand prone. I would have my stabilizing hand on the superior aspect of the shoulder, and then my testing hand on the distal posterior part of the humerus, proximal to the olecranon. So I'm going to have my patient extend her arm, so she's going to go backwards into shoulder extension. Good. And I'm going to apply some resistance as she does shoulder extension again. Good. Now she's going to go back into that extension position, and I will perform a break it test. So I'll push down as she pushes back on me. Good. And I will be testing the latissimus dorsi muscles and the teres major muscle. This is a shoulder abduction manual muscle test. So I'd have my patient seated with her hand just hanging to the side. My stabilizing hand is on the superior aspect of the shoulder, and my testing hand will be on the distal portion of the humerus proximal to the olecranon. So I would just have my patient extend her arm outward, abduct. Nice. So now I'm going to apply some resistance as she repeats that motion again. Very nice. Now she's going to go back into abduction, and I'm going to apply some resistance as she pushes back on me. Very good. And this will be testing the deltoids and the supraspinatus muscle. And this is a shoulder adduction manual muscle test. I'll have my patient seated with their arm out in about 70 degrees. I have my stabilizing hand on the superior aspect of the shoulder, and my testing hand on the distal posterior part of the humerus. So for adduction, my patient will bring her arm towards her body. Okay, good. And now I'm going to apply some resistance as she repeats that motion again. Okay, good. And now she's going to stay in adduction, and I'm going to apply resistance while she pushes back on me. Good. And these muscles that are being tested are the pec major, the latissimus dorsi, and the teres major. This is a manual muscle test for knee extension. So I have my patient seated with her feet on the ground. My stabilizing hand will be on the distal portion of the femur, proximal to the knee joint, and then my testing hand will be on the lower third of the tib fib. So for knee extension, I just have my patient lift their foot up until their leg is straight. That's good. Okay, so now I'm going to apply some resistance as they repeat that motion again. Very nice. Now she's going to stay in extension as I push down, and she's going to push back at me. Good. And this will be testing the quad muscles, so rectus femoris, vastus lateralis, intermedius, and medius muscles.